Hello everybody. So here again, now with my hat today, I'm from Salisbury Plain PCN. So that's where we work together as Avon Valley Practice and Stern Health Group. And it's the group that have been delivering your COVID vaccinations, some of your flu immunisation clinics as well. So we're coming at it from 2 points. So I've got Sally with me as well. So she's representing Stern Health Group. So can we just have a wave to Sally? That'd be awesome. A minute, you're still with me. Yeah, hang on. So there we are. There's Sally.
Hi everyone. Okay, back to you, Anna.
Okay, and then I'm representing Avon Valley Practice, but also our PCN. So we're here to talk to you about opening times and to explain what we're doing and how we're doing it. But before I go any further, we're just going to recap on what is normally a live event. I just do this because I'm aware that some people are new each time in the live Q&A kind of chat. So remember, you can post any questions here about basically anything, although our main topic of conversation is opening times. So let's get on, do that, use your chat, remember to like things, and as other people write them rather than write another, the same question again, just because it helps me make sure that we answer. Okay, so without further ado, let's carry on. This is all about opening times and what we look at. And it's where the NHS are looking at extending the opening times of general practices, so your doctor's surgery. And it's not about us individually doing that, that's about our group doing it. So for both practices, our regular opening times are from 8 o'clock in the morning until 6:30 in the evening, Monday to Friday. And we are required for, from the 1st of October to be doing another 18 hours on top of that must be provided between 6:30 and 8 p.m. weekdays and any time between 9 and 5 on a Saturday. And a range of appointments must be available. Okay, so that's 18 hours between the two practices working together to be able to give you kind of access outside of our regular times of 8 until 6:30 weekdays. Okay, so that's what we are kind of been tasked to do by NHS England. Now, just to recap, we're going to talk to you about what we currently offer. So we currently offer, indeed, those hours in addition. So we do them on a Monday night at the moment. Have done that for many, many years to be able to do that. So on a Monday, we currently have GP appointments available. We also have nursing appointments available and mental wellbeing appointments available. Okay, so that means on a Monday, you're able to see a GP face to face on the telephone, and talk to them on the telephone, should I say, not see them on the telephone. So see them face to face or talk to somebody on the telephone in the evening from 6:30 until 8. Now you can see people in Durrington Surgery or in Millstream Medical Centre. We also have a range of face-to-face appointments with our nursing team, and that's practice nurses and healthcare assistants. And they offer all the services they do during the day, except those that involve blood tests. And that's only because it doesn't come to collect the blood test until kind of lunchtime at both practices. And therefore we can't store the bloods overnight and get ready for that. So we offer things like smears, NHS health checks, wound management, immunisations for children, as well as immunisations and vax for adults. To be able to do that, the whole wide range of services provided by our nursing team. And we also have our mental wellbeing workers. So at Avon Valley, that's currently Claire, soon to be Kaylee as well. And at Sarum Health Group, that's Penny, and another Claire, soon to be as well. And they, again, are face-to-face or telephone calls. On Thursdays, we also have appointments at Millstream, which have nursing appointments and our mental wellbeing appointments as well. Again, usually face-to-face, but some telephone calls as well. And then on Saturdays, we've arranged with Salisbury Walking Centre, that's based at Millstream Medical Centre, to see patients face-to-face or indeed offer telephone calls as well for anybody that wants to come in. And the reason for doing that is we've got, the setup with the Walking Centre, whereby actually you can, receive urgent care as well as routine care on the front when you're a patient of Avon Valley or a patient of Sarum Health Group. So that's what we're currently offering. Okay. Now, we're aware that due to the pandemic, other organisations perhaps haven't been doing that, and that's fine, but we've held true to our kind of requirement to keep offering this kind of extended access, let's call it that. So that's what we've currently been doing. So now when it comes to the 1st of October, when we are looking about what to do with NHS England, we've reviewed what we're currently offering and actually gone, hang on a minute, we're going to be offering 22 hours a week on Mondays, as described, on Thursdays and Saturdays from 8 until 2. 8 until 2, 10 until 2. So as I've just described, we're looking at actually just continuing our offer that we've been delivering to you for many years and saying to NHS England, actually, this works really well. We get a great uptake, very little DNAs, so that appears that we've got it on the right days at the moment and what that means. And it's to come out and talk with you about, does that really work from your experience, your perspective, and if there's anything else that you would like us to consider. The reason that Mondays we think works well today has been because it's after the weekend, and where we've been closed for a couple of days, actually having that availability on a Monday, you know, to kind of get things done, sorted out, works kind of particularly well. With a follow-up on Thursday if things are needed, but also then Saturdays, and to look at that you've got your routine appointment. So our kind of question to you, really, in terms of what are your thoughts about that? You know, are there any other services you'd like us to think about offering in those times, or are there different days of the week that you think would be better? Now, I know that's quite a difficult kind of question sometimes to do that, but it's kind of going, well, what do you think about it? And, you know, almost for us, no news, no feedback means you're kind of happy. You know, Mondays work, Thursdays work, Saturdays are available to you. And because we've got the additional hours of 22, means that, you know, even if somebody calls in sick, we're still kind of above the NHS England minimum requirement. And we've tried to consolidate the working pattern so that nobody's working on their own. They've got access to, you know, other members of staff in the building as well. So if you were to be seen by a nurse, say, on a Monday evening, you know, the nurse can go and speak to the doctor rather than you having to book another appointment to come back. So that's what we're looking to say to NHS England we'll continue doing, but we just really wanted to come out and say kind of, what are your thoughts? Can you share that with us? What would you like us to do in addition to that or differently, so that we can consider that? Like anything, deadlines are always quite short, so we do need to submit our proposal in kind of 2 weeks' time to NHS England, or to our CCG actually, who then submit it onto NHS England for approval. But at the moment, that's our position. So it would be really good to hear from you about our proposal and whether or not there are any changes. So I'm just going to kind of leave you a couple of minutes to put anything in the chat that we can then have a further discussion about, so that we can, you know, like I say, hear from you about what your thoughts are. So if you can, type away, that would be awesome. At the moment, I don't have any comments. I'm kind of hoping no news is good news. That's not like you to be quiet on me, to be able to do that. Normally you suddenly have got something to say, which is what I really like about our groups. There doesn't seem to be anything quite to do that. But just while you're having a think, Sally, is there anything that you'd like to add from Sarum Health Group's perspective for patients that are with Sarum Health Group? Okay, Sally is shaking her head. But that means I've done a good job of representing both Avon Valley and Sarum Health Group with the position, to be able to do that. Again, most of you probably know that our staff who are working. So at Avon Valley Practice, Dr. Green and Dr. Miller-Craig tend to rotate the GP clinics on a Monday. And from what I understand, I think it's Dr. Chet and Dr. Holdsworth. Is that right? Have I got that right? No, just Dr. Chet. So it's Dr. Chet at Sturm Health Group, and then Dr. Green and Dr. Miller-Craig, who are the doctors working on a Monday. Well, completely silent on me. What is happening? What's happening? I'm scared to do that. Helen's just passing. Okay, so hang on, we've got great anonymous. Excellent, thank you. I'm sure that this is appreciated. Oh, cool. Well, that's really good. Thank you for that. Thank you for that background to us do it. Remember, I think probably there might be things that happen or you think about in the next kind of couple of weeks. Now, both practices have kind of feedback forms to be able to do that. Now, actually, sorry, can't hear you. Hang on 1 second. Right, can you hear me better now? Can you hear me better now, everybody? Oh no, so maybe I should just repeat what I've been saying. So can we just go back? What I've been saying about is NHS England's kind of requirement for us all to increase our kind of extended access. So to be able for patients to be able to get hold of us and have appointments outside of our regular hours. So that's 6:30 until 8 weekdays and Saturdays 9 till 5 to be able to do that. Now, as you can see, we currently offer that anyway. So it's about whether or not we need to change this to something else. Now, our minimum requirement is 18, and in this scenario, you can see that it's 22 hours a week. And it's really important that we offer the whole range of services to you, rather than just kind of one person. So Kathleen says, yes, you can hear. Brilliant. Awesome. Thank you for that, Kathleen, to be able to do that. So always need a headset. I think that's the most important thing, isn't it, in terms of those things to look at and to see what else we can offer. So like I've said kind of here is, you know, we've got 20 hours, 22 hours. That's what we're looking to offer. But what else would you like and how? Now, somebody else has said, on Sundays, is there any help available or do we have to go to A&E? Now, that's interesting. So extended or improved access, whatever words you want to use about working outside of core hours of 8 until 6:30 Monday to Friday, is actually there's a lot of research being done about Sundays, and where organisations have provided Sundays, actually they haven't been very popular and have had quite a lot of DNAs, what we call did not attend. Now we think that's partly because actually, you know, do people really want to come for their IMS and vaccinations, their smear tests, their NHS health checks, routine things, because this is about improving routine care, not urgent care. So when you've said about, you know, other than A&E, there are other services to use outside of our regular hours every single day. So it's always 111. And that's what they promote to, you know, everybody across England, is that actually if you need care outside of the core hours of your GP practice, is to be able to phone 111, and rather than go to A&E, unless of course you've got a life-threatening emergency. If you have a life-threatening emergency, absolutely you go to A&E to be able to do that. But actually anything else, you can phone 111 first. You can also go to Salisbury Walk-in Centre if your Salisbury is the closest, and there's, you know, other what we call minor injury units in Chippenham, and also then in Trowbridge as well. So there are other services around and available for you to be able to see, but I always kind of recommend phoning 111 in the first instance, who can then guide you to what is available when, and sometimes can actually kind of care for you on the telephone and ensure that you don't have to then travel around and wait a long time. So that's what happens, and that's where I think NHS England hasn't kind of promoted us or required us to be covering Sundays, because of that kind of background knowledge about what's happening and what's been going on. So that's where we've centered our time on, you know, weeknights and Saturdays because of that. So it's about trying to give you the optimal access. And as I said from the outset, well, not the outset, but through the talk that I've been giving today, it was about, you know, we've been running these services on Mondays and Thursdays and Saturdays for, you know, a long time, and they've been very well received, as in well used. We have hardly any you know,
DNAs. There's hardly any no-shows. People seem to attend when they've booked these routine appointments. So from your kind of decisions and things that have been ongoing for a long period of time, this setup seems to work well for you. But it is important that we consider what else you may like. We don't want to just assume, and hence why we've come out today to find out what your thoughts are, so that we can take those considerations into place when we're then developing the plan that needs to launch 1st of October. But, and I think make this really clear, we're already doing this already. So for you, it won't make any change if you're a patient of Avon Valley or Sarum Health Group, because we're already doing it and offering that range of service to you already. So it's just about looking at that wider and going out and asking for clarification, because this is our opportunity to change it. However, you all know me, you all know Sally, you all know our doctors that work with us, and I think what we've shown to you throughout the pandemic, particularly and now going forwards, is that we listen to you, and if a change is needed next year, then we would do it. We'd consider it and look as to what we can do to improve the services that we deliver to you. So if you can share with us what your thoughts are, that would be great. We kind of have to go with no news is good news, but remember that we've both got websites, both it's Avon Valley practice.co.uk, and I think it's sarumhealthgroup.co.uk as well. So you can put your thoughts in there online. By all means, feedback to reception, because they will gather the information too and share it with us, so that then we can make those adaptations. It's just that we have to put our kind of proposal forward to NHS England the week beginning the 18th of July. So we kind of need to know what your thoughts are this week or next week, so that we can kind of formulate that and put that together and take that into consideration before we kind of press submit. But like I've said, this is all things that we've been currently offering. So I just want to go back to that so you can see it on that regard. Okay, so obviously I've given you a bit of time to kind of put your thoughts forward, and 4 of you have brought that in, which is great. Again, keep putting your messages in, but now I just open it up, as I always do, to any questions at all. So has anybody got any questions at all about healthcare in general, Sarum Health Group, Avon Valley Practice, what we do as a collective, anything at all, just general things? Always interested to hear. Always like to hear what you've got to say. So if you can, if you want to ask any question, that I will do my best to answer it. We still haven't got any questions. This is right in terms of those things. So yeah. Okay. So it's going to be probably a relatively short one today. So I'm going to leave you on that note of saying, thank you for joining us. So to do that, find out what's been going on. Probably, hopefully, a bit of reassurance that we are doing what's in line with NHS England's directive. Indeed, I've continued to do it, and I'm happy with that. I can just see another question come in. Oh, okay. So Anne says, please could you text to let us know when a telephone appointment has been made? We've had several appointments that we don't know about. Oh goodness, Anne. Okay. Right now, whether you're at Avon Valley Practice or whether you're at Sarum Health Group, and Anne, I don't know which practice you're with, but what we've got on our setup with our telephone system is that in terms of that, the system isn't set up to send a text message about a telephone appointment, because they're not actually timed. You're probably aware of that, because always at the ends of clinics or at the beginning of clinics, and depending on how long each telephone call lasts, it might be a bit sooner, it might be a bit later. But what we'll do is check our kind of systems to see that whether or not we can kind of say, yes, you've got a telephone appointment today, because I agree with you. It's always good to get that reminder, especially when you've booked it routinely in advance. It's quite easy to forget that, especially if we don't remember. But do kind of go with the faith that actually sometimes our clinicians will phone you pretty much out of the blue in terms of follow-up. So if they've just received, say, a test result, they won't book you an appointment to speak to you in a little bit. If they really need to speak to you, they are just going to phone you, and there won't be an appointment about that, because they'll be trying to get hold of you to take some kind of action that's needed on that front. Same as if we receive a letter from the hospital that requires action, that, you know, we don't want to wait to try and, you know, see you in a day or two. The doctors may well be calling you kind of, you know, not out of the blue, but when you weren't expecting, just because we are trying to get hold of you to do that. So that's, you know, as best as we can look at that. Kathleen said, when does it start at Avon Valley Practice? This was already in place, these hours, Kathleen. They've been in place at both practices for many years. It's just that NHS England are kind of relaunching this across England to make sure that all practice groups, you know, Avon Valley Sarum Health Group is one group. You've got other what we call PCN groups working together to make sure that we're all doing that you know, as a standardized format across England, and depending on the size, depends on the number of hours that are required, and therefore then we need to look at how best to do that. So because we only contractually have to provide 18 hours a week, really we kind of look at, you know, 2 evenings a week and a Saturday to make sure that we've got that breadth of service across the week with the breadth of staff available. Hopefully that's answered your questions. Now I've got another question here. It says, are you going to continue with the 9 minutes cut off on the phone? Now, I don't know if you're talking about Avon Valley Practice or Sarum Health Group. If you're talking about Avon Valley Practice is currently piloting a voicemail service, whereby if you haven't been answered in 6 minutes, it asks you to leave a message so that you don't hang on the phone waiting to be answered. Instead, leave a message and then we will action your request, send you a text message back to say we've done it, potentially phone you back if need be, book you an appointment, etc., that's needed, rather than you wait on the line, because that doesn't really kind of help anybody when the phone lines are particularly busy. And of course it does kind of go through what we need to do, because if we can deal with your query as quickly as we can, sometimes that means, you know, doing it in different ways but not causing you too much inconvenience, because nobody really wants to be sat on the phone waiting for ages, and you are still prioritized, you're still listened to be able to do that. I don't know if there's anything happening in Sarum Health Group. No, so there's no voicemail service at Sarum Health Group, so we assume you're kind of working on the basis that it's Avon Valley. I hope that's answered your question. So then Nikki's asked, oh, not a question, but really happy with my surgery, Sarum Health Group. Always managed to see a nurse and talk to a doctor. Brilliant service, thank you. And the lovely receptionist too. So that's a lovely bit of feedback as well, because it just shows in terms of trying to get our kind of placement right about the, you know, managing your kind of requirements with what our capacity is. So that's fantastic. Mary's written, when a telephone appointment, but I'm not too sure what that question is, Mary. So I can't really answer it without a little bit more information. But now Anne's come along. Let me just see what she's saying. We are at Salisbury, and my husband Steve has had at least 3 appointments he didn't know about, and because he couldn't answer his phone, he rang the surgery, but they didn't know anything about the call. Sorry to sound like we are whinging, but it's very worrying when this happens. Yeah, I understand that, because actually if you're getting a call out of the blue, then you can't kind of get back. You do wonder why the surgery was trying to get hold of you to be able to do that. So yeah, it's about understanding that, and I'm sure Sally will take that forward to look at, because there are all kind of, there's always an audit trail about why somebody's trying to get hold of you, because we don't want that worry. We understand that, so there should be kind of continuation of that, so that whether you speak to, you know, a receptionist, an administrator, manager, you know, any of the clinical team, etc., there should be that continuity of care, because that's what we, you know, pride ourselves in, trying to do that. To be able to do that. And then Mary says, when the clinician rings and we don't answer in time, can they try again 5 minutes later instead of going to the back of the queue and trying again a long time later? I think that all depends on clinical need, Mary. It's quite difficult with that, about what's happening. So when they've tried, you know, to get through, they will go back and try, in terms of that, usually a second time, but it's just trying to get through everybody that needs a call. If you can share which practice you're with, that's probably quite helpful in terms of, you know, both practices kind of find out where that position is. But again, this is what's really good about a meeting like this, is that both practices get feedback, and both practices can consider the feedback, whether or not it directly relates, you know, is feedback about a particular experience in a particular practice. Actually, we can all learn from that and all see how we can, you know, improve healthcare together. So hopefully that works. Okay, any other questions? Do tell me if you think I haven't answered your question sufficiently, because I will do my best to come back to you on that. No? Okay, so just on that note then, remember, do give feedback either in person when you contact the practice, indeed through our website, you can give feedback about that, but please, if you can do it this week or next, that would be brilliant. Then we can collate that and put that into our plan accordingly and try and work those things through. So yeah, we'll definitely listen to you and work out what we can do from there. But like I've said, I think kind of based on what you've been doing and how you've been using the services for many years, we kind of think this is an established kind of system and service whereby you know what availability there is within the practice, or within both practices, should I say, collectively, to be able to do that. What's important to know is that even if you're with, let's say, Avon Valley, you can access services that are available at Sarum Health Group and at Salisbury Walk-in Centre, because that's a joint one to be able to do that. Equally, if you're at Sarum Health Group, you can access at Avon Valley, or indeed Salisbury Walk-in Centre as well. So it's not just about accessing these kind of additional hours just within your practice site, although we obviously understand that for continuity of care, actually that's what quite often you prefer to do, but you've got that availability should you wish to do it, and I think that's important to know. Okay, so at that point then I'm going to sign off. Okay, thank you so much for your time this evening. The sun is shining, get out there again, but again, leave us your feedback, it's really much appreciated. Many thanks. Bye.